This cream is used to treat long-term psoriasis. It contains anthralin, which is a man-made version of a natural substance found in goa powder from the araroba tree. It works by slowing down the growth of skin cells. This cream does not contain a corticosteroid or coal tar. It is not meant to be used for a severe outbreak of psoriasis, and should not be used on inflamed or irritated skin. It is best to apply this cream at a consistent time each day. Follow the dosage instructions provided by your doctor. It's important to follow your doctor's and pharmacist's directions carefully when using Drithocreme HP cream. This medication is meant to be applied to the skin and/or scalp, and it's important to use plastic gloves to prevent discoloration of your fingernails. For psoriasis, apply a thin layer of the cream to the affected area once daily, making sure to rub it in well and to avoid the surrounding normal skin or scalp. If the surrounding skin becomes too irritated, you can protect it with petroleum jelly. When treating the scalp, wash your hair with shampoo to remove loose scales, then apply the medication as directed. Be sure to follow your doctor's instructions on how long to leave the cream on the skin or scalp, usually starting at 10 to 30 minutes per treatment. Afterward, rinse the area with cool to lukewarm water and, if treating the scalp, shampoo your hair. Always rinse your hands right away after using the cream, and be careful to avoid contact with your eyes, mucous membranes, or genital area. If you experience irritation, especially in sensitive areas like between toes and fingers, on the face, or in skin folds, stop using the medication and contact your doctor. Treatment is typically continued until the affected area is completely clear, and it's important to inform your doctor if your condition persists or worsens. If you experience temporary redness or irritation after applying Drithocreme HP cream, it's important to let your doctor or pharmacist know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects, but it's important to tell your doctor if you notice increased soreness of the skin or spread of psoriasis. Drithocreme HP cream may temporarily discolor fingernails, gray/white hair, as well as stained skin and fabrics. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, be sure to contact your doctor or pharmacist. And remember, it's always a good idea to consult a healthcare professional for any concerns. Before using Drithocreme HP cream, it's important to discuss any allergies with your doctor or pharmacist. This cream may contain inactive ingredients that could cause allergic reactions. Also, be sure to inform your medical history, especially if you have kidney disease. To prevent staining of clothing or bed linen, you may want to use a protective dressing. After washing off the cream, make sure to rinse the tub or shower with lukewarm water to prevent staining. Then use a cleanser to remove any leftover deposits. If you are pregnant, only use this medication if it is clearly needed and after discussing the risks and benefits with your doctor. It is uncertain whether this drug passes into breast milk, so consult your doctor before breastfeeding. When using Drithocreme HP cream, it's important to be aware of potential drug interactions that could affect how this medication works or increase your risk for serious side effects. It's always a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Drithocreme HP cream. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., residents can contact their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important not to share this medication with anyone else. This medication has been prescribed specifically for your current skin condition, so it's not recommended to use it for any other skin condition unless instructed by your doctor. If you need to rinse off the medication, you can use a wet wipe to remove any excess before doing so. If you forget to use Drithocreme HP cream at the scheduled time, use it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Don't take a double dose to make up for the missed one. When storing Drithocreme HP cream, make sure to keep it at room temperature and away from light. Keep the container tightly closed to prevent any contamination. It's important to keep all medications out of reach of children and pets. When it comes to discarding the cream, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly dispose of the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to get rid of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.